Hi everyone, welcome to this National Health Executive webinar in partnership with Abnormal Security. So in this webinar, we will be delving into a modern approach to NHS email security as the email security game has changed. The traditional defences used to secure NHS email environments often fail in the face of modern attacks. Oh, sorry, I've put my words back in. The traditional defences used to secure NHS email environments often fail in the face of modern attack tactics. Secure email gateways have been good at detecting and blocking malicious attachments and links. However, new attacker techniques often sidestep these traditional defences. So the NHS must adapt to the new threat of the landscape. We will discuss why email attacks are increasing at an alarming rate, why traditional email defense solutions are missing modern attacks, and what the NHS security teams can do better to protect against evolving attacker techniques. To help dive into these, I'm joined today by a brilliant group of guests with far richer expertise and experience on this than myself. So we'll be bringing them into the conversation now. But with me today, I have Hannes Heridine, Cybersecurity Manager, South London and Maudsley NHS Foundation Trust. James Dunn, Public Sector Lead from Abnormal Security. Kelvin Hipson, Joint Chief Information Officer at Royal Cornwall Hospitals, NHS Trust. And that's it. Joining us for today. Welcome, everyone. So just before I pick your brains, I just want to set the scene a little bit and explain some of the great functionality we have on offer to ensure that you guys have a great experience during this webinar. So you can put in your questions on our live Q&A function on the right-hand side of your screen. So if you put a question in there, it will come straight through to myself, and I will ask our esteemed guests to answer them as best as they can for you. So we will also be running some poll questions to get your feedback. So please do join in and let us know your thoughts. As mentioned today, this conversation will be examining a modern approach to NHS email security. We will ask the questions about the modern threat landscape and its impact on NHS email security, and how attackers use compromised NHS email accounts to launch attacks into other trusts. What modern attacks look like, their volume and nature, and what Abnormal are seeing across NHS trusts and the broader healthcare industry. And also we'll be asking how the NHS can use the latest AI behavioural technology to protect against modern attack vectors. But I think we can probably agree that's enough from me at the moment. So let me bring into the conversation the real experts, the people you're truly here to listen to. So over to the panel, and James, I'll open up with you if that's all right. So if you can give me a broad explanation of what Abnormal does and what they do in email security.
Sure, and thanks for hosting the session today, Jack. Well, I think as everybody attending the session knows, email is the number one vector for launching attacks into an organisation. And put simply, Abnormal uses behavioural AI to block all forms of business email compromise attacks, supply chain fraud, ransomware, spam, and so on. And we do this with an industry high precision. Our API effectively integrates directly into Office 365 or Google, and we use that behavioral AI to baseline known good behavior to detect and block anomalies as they come out. And really the solution just takes a few clicks to deploy, minimal management overhead, and prevents 99.9% of malicious emails from reaching users. And we also help security professionals gain kind of control and visibility into attacks, and adjust their teams through power of automation so that they can spend time on other critical challenges that the NHS have. And that's pretty much it in a nutshell.
Our experts as well. So Hannes, do you think we all make full use of NCS mail check? And also, do you find it valuable in terms of getting email security compliant?
Right. All right. So, well, I'm not sure how well versed everyone with the NTSC mail check, but to me, to us, especially for NHS organization, mail check is a very valuable tool where we can check on how can we ensure that we comply with email security. And also there is a requirement from NHS Digital as well that we need to meet certain standards that being published And there's a baseline as well that we need to meet from the NCSC guidelines. So talking about NCSC, though it may not be available to all private companies, it is available for like government bodies, local authorities, NHS organization, academic charities, and it is a very valuable tool to be able to check how well you are complied with configuration. For example, your DKIM, DMARC configuration, your SPF, your TLS configuration, SSL certificate. So we make full use of that information to ensure that we regularly comply. Well, of course, there are certain times when certain changes happen, then we start to see, oh, there's some line in the SPF record that somehow make us feel SPF compliance. So it is a good tool right now, free to use, especially to NHS organization to check how well we are in email security. Yeah, so I'm not sure how well others may have used it, but we does make full use of it. I personally go in and check almost like every week. I check if there's any alerts that appears in the NCSC mail check. If there's anything that I need to follow up, anything that I need to fix. So yeah, it is a very good tool for NHS especially.
Kelvin, do you have anything to contribute to that one?
Yeah, so I think probably what I'd add is so obviously in Cornwall and the Isles of Scilly, we actually support our services across the whole county. So so it's not effectively just one hospital that we're looking after. We're always mindful of the threat to our services county-wide. So I think probably listening to the comments from the first two speakers, the thing I'd probably add is increasingly our focus is on real-time response. So absolutely, do all the things in terms of annual compliance checks, use all the tooling available, but your kind of last stage of call is a real-time response capability, and we're absolutely making use of that on a regular basis. I think fundamentally it's the whole approach has got to be one of you can never be complacent,
No, for sure.
and so always looking to do more.
And that's fantastic that you're always pushing for that little bit more, because we always want the best for our patients as well. And James, I'll bring it back to you again. So what is the current landscape as far as email security challenges are concerned?
Okay, thanks, Joe. I mean, over the last 2 years, the prevalence of email-borne cyber threats, which was already really high, has kind of soared to new levels, I guess, over those 2 years. And what we've seen is a huge rise in things like business email compromise, and also there's been the attack volumes across ransomware and phishing have really gone to new levels over these last couple of years. And going back to what Hannes was saying around the NHSC kind of security compliance checks, I think the challenge for a lot of organisations, and very much including the NHS in this as well, is that a lot of these attacks are very much advanced in their nature. So while some of the kind of previous technologies and approaches to preventing these reaching organisation were very successful, the threat actors have adapted their strategies. And looking at things like business email compromise itself, the FBI every year kind of launch or come out with a report which highlights what they see from an FBI level, and business email compromise attacks have just increased dramatically over the last couple of years. And I think in their latest report this year, they said it's $43 billion of losses that have been incurred over the last 5 years due to this. And that's really just a reflection of the advances that threat actors are making are getting these through traditional systems, getting them to pass things like DKIM and SPF and DMARC to end up reaching users and having an impact. And as many organizations have kind of shifted into cloud email, whether that's Office 365 or things like Google. What they found is kind of the traditional legacy tools that people have deployed to stop these kind of attacks just aren't able to kind of keep up both with the volume of advanced attacks and the nature where they've been designed to get past those traditional defenses. And I guess the other challenge in it, it comes back to what some of the other panelists are talking around, is around actually the security operations side of things. The reality is that there's 2.7 million, I think it was, of unfilled cybersecurity roles out there, and security leaders kind of really feeling the impact of that scarcity, if you like, of professionals. And I saw a study last week, I think it was, coming out from ISC, and it was highlighting, I guess, the challenges organizations have with being able to respond in real time and properly assess and manage the risks as they come in. And I think the NHS and the public sector in general are really good examples where there's often not enough time to actually resolve and investigate and manage the threats as they come in. And so I think I guess in summary, from a landscape perspective, there's this wave of new challenges that are coming in from an email perspective, and that the kind of solution leaders and things like that within organizations need something that's both effective at stopping those, but also really, really easy to manage and administer due to that that role scarcity, if you will. And what we're seeing at Abnormal is from our side of things, and from our from looking at our customers, is that very much these attacks are rising month on month, and it's becoming a real challenge and headache for organizations to manage.
Definitely. No. So just the first question that springs to mind out of all of that. So how can the NHS kind of cope with that? What can they put into place to stop these attacks happening? What resources is there available to the NHS that could improve this? If Kelvin or Hannes, you wanted to answer that one.
I'm happy to come in terms of how we're responding, because I recognise all those points that James has made. Absolutely recognise the change in the threat environment. I'd say not just in terms of email, but in terms of all threats. We've kind of gone from you might see a critical vulnerability once every few months or so to effectively. We're pretty much continually working on either kind of responses to threats or incidents that have popped up, and that's really been the driver behind this change in thinking in terms of developing our own cybersecurity operations centre to complement the national capabilities. And recognising those challenges in terms of staffing. Again, obviously in Cornwall, we're in a far-flung part of the country. Actually working with our local colleges in terms of they're producing graduates trained in this sort of thing. So we're really looking to become probably a first port of call in terms of people starting a cyber career. Some of them will then go on to other organisations, and actually, we're helping the local economy in terms of those capabilities. So, very much, the scale of the threat is that we're clear that we need a 24/7 operations capability to manage this threat, because some things are getting through, and whether it's kind of user education in terms of them spotting it is a key part that I'll probably talk about in a few minutes. And then obviously our automated responses, but ultimately, as I say, keep coming back to that backstop of a professional taking action.
Yeah. Let me add up to that as well. I do agree that resource is an issue as well, especially for us in London, to be honest. Getting a cybersecurity person to work with the NHS, that'll be quite a challenge, especially trying to challenge all the other big organizations out there with a better salary package, to be honest. But so in another way for us to cope with that, yes, I do agree that we do need 24/7 operations. Like for us, yes, we do work with a third party to help to secure and to constantly check through our email security. But on top of that, we have a number of solutions, layers by layers of solutions. Some organizations just make full use of whatever email security that might be provided by Office 365, for example. But then for us, sometimes Office 365 may be able to block a certain number of phishing mail or scam mails, but might not be able to detect an advanced one. So we still need to put another one on top of it or in front of Office 365. So whatever comes through goes through that solution first, filter it out. Okay, perhaps it might pass through the first filter and goes to another filter. Then it goes to the Office 365 filter to fit out. Well, then again, of course, there are a small number of advanced and specific targeted attacks that somehow might still be able to pass through. My experience was that yes, we work in the NHS organization. People work 24/7, and there are people that might have clicked whatever spam mail or scam mail in the midnight that only reports back to us the next day in the morning when we come back, starts working. Then only you'll be able to start to initiate the investigation. Then only we know, okay, whether whatever that they have clicked, did it initiate any kind of threats or ransomware connection or whatnot. So yeah, it is quite a challenge.
Yeah, I mean, just to come back on those 2 points, Jack, sorry to interrupt you there, but
No, go.
well, first of all, just to clarify one of the questions we had in the chat, the 2.7 million of vacancies was worldwide, right? Not just in the UK. Just to clarify, I think we'd be in dire straits if if that was the number. But you're absolutely right, and I think it's Gartner that was saying that by the end of next year, they estimate that I think 40% of organisations will be using the native tools within the cloud platforms to prevent things like email threats from reaching users. But you're absolutely right in what you're saying, Hannes, in that fundamentally those tools and kind of the more legacy solutions in this market, really what they're doing is they're looking for things that they know to be bad, so things that they've seen before. So a ransomware and the associated signature that's been seen before in the wild, a phishing link that's been out there, and you can see on Virus Total and things like that. And they use this kind of threat intelligence to say, right, I've seen that before. I know that to be bad. Therefore, I'm going to block it. The reality of this kind of modern threat landscape when it comes to email is that a lot of these attacks have never been seen before. They're either delivering 0-day malware. You're sending phishing links that have only just come into existence and they last for a very short period of time before dropping out again, or they're using things like social engineering to trick users into doing things they're not meant to. And if you're looking for something bad in an email, that's really just trying to take advantage of the human psychology effectively. There's nothing bad for them to latch onto. They're just trying to trick people into giving them a list of people they owe money to, or they're trying to get them to engage in a gift card scam or update bank details and things like that. And there's no threat attached to it other than the actual content and language that's in the email. And I think that's the challenge for the more traditional players, is that they're just not able to understand that. And obviously that's kind of where Abnor will come in, but I'll leave that kind of side of the pitch for later. But that's kind of the reality of the challenge that all organisations are facing, and the NHS are included within that.
Would there, just to pop in on that as well, would there be any opportunity for like education on that front as well, or would there be what you were saying with sort of phishing emails and stuff like that? Would there be any sort of education at a younger age, and obviously at a higher age, an older age as well? Would there be anything like that to go on top, if you know what I mean, James?
I'm interested to see what the other panelists say on that as well. But I think from my perspective, training is absolutely part of a security posture, right? And obviously, and as Kelvin was speaking about earlier, that you can kind of get people, I guess, around to understand these challenges, that that you can kind of incubate the next generation in that world. But the reality is that whilst training is very much important, you're kind of relying on people being in the right frame of mind to enact that training. And I think putting the burden on individuals at particular points in time when potentially they're meant to be focusing on things like patient healthcare. Putting the burden on them to enact on this training is not necessarily, I guess, fair on them. I think stopping them receiving the threat where possible, which should be the first point of action. That training absolutely does come into any security posture. But yeah, Kelvin and Hannah, I'm interested to hear your views on that.
Yeah. Hannah, did you want to go first, or shall I? Don't mind.
Go ahead first, Kevin.
Yeah, absolutely agree in terms of first off, try and stop it. But as I say, we know things are going to get through. So we kind of do a multi-channel approach, really, I suppose, in terms of we do targeted phishing training campaigns. So we will send out emails. My team are so strict about it, they don't tell me. So I always live in fear that actually it will catch me. It does the usual thing of if you click on a link and divulge anything, you get taken off to the page of shame to receive your training in terms of what you should have done. Those are actually really interesting exercises because we've tried to work across, I suppose you would almost say, like different levels of recognition of the threats. So if you do one of the fairly obvious ones, people do pretty well at that, and very few people click on it. It gets harder when things are more convincing. So we're trying to help people to be even more mindful in terms of those sorts of threats, and actually also try and make that kind of link up to your personal life. So effectively saying, if this is happening to you at work, this will be happening to you at home as well. And in neither case would you want to divulge anything. And then kind of back up again with we've got a real-time messaging platform, so we'll literally pop out live messages to everybody, which live messaging and kind of really simple messaging on your lock screen seems to be more effective than emails. Nobody reads kind of the official email from the IT department that says please don't open dodgy emails. So I think we get more benefit from those other channels.
Yep, I would certainly agree with Calvin as well. Mass email, people might not read it. People must, depending on whatever email solution that they use, people might not see it. I do agree that we also use certain types of notification suddenly pop-ups on everyone's screen if we are seeing a trend that a lot of targeted or spam mail or phishing mail being flying around throughout the trust, just to let everyone aware. But then again, yes, I do agree. Yes, awareness and training can do so much. But then again, sometimes when you're not in the right of mind and when you're panic and something, for an example, a recent one, someone was just recently caught speeding, and he actually thought that the police sent over an actual summon ticket to his email, but then again, it was actually a spam, not an actual summon ticket from the police. He or she accidentally click it, open it up, and just suddenly thought, oh, this is not right. They didn't say that they want to send this over email. But then again, when check back through mail, it's actually a targeted scam email. But luckily, we got a number of solutions that basically somewhat averted from that PDF file to be executed. So again, sometimes the user, of course, they always say that sometimes it's the user weakness that at times this might happen. Awareness and training, yes, you can always do regular training. We have like weekly training that people can join in. We even do like masterclass, cybersecurity masterclass to our trust users. Hey, would like to learn more about cybersecurity? Please come and join us to our special masterclass about cybersecurity, ransomware, phishing attacks, how you all see this, what are the advanced version. So yeah, but then again, all that it needs to work together as well. Awareness training, third party solution, of course, SOC plays a role as well. And sometimes, if you are still working in the office, you can just sit down next to your office and, hey, do you saw this email from this and that? Does it look like scam mail? Then basically we can start having more education with the NHS staff. Though there is another challenge as well. When we have been communicating so much about phishing emails, scam mails, attacks, sometimes when valid email, they'll start asking, hey, is this a real email? Which by right, it is an actual email. Which then again, somehow adds up again to our workload to see and check whether if this is a valid email or not. So I would say that somehow we also need to find a balance on what's going on right now.
No, for sure. That was fantastic. Thank you for that, Hannes. So I'm just going to quickly move on to our poll that we're going to be running today. We've got 3 questions, but I'm going to start off with the first one. Start from the beginning, as they say. So how much of a priority is addressing email-based attacks within your organization? So if everyone in our audience, if you can go down to the live poll and pop in your opinions down there, that'll be fantastic. I'll let that run for a couple of minutes. I'll go back to James with another question, if that's all right in the meantime. What unique threats are the NHS experiencing, and how does this differ from other sectors and regions?
Yeah, so I was actually kind of really, I guess, thinking about that as listening to Kelvin and Hannes there, and that when we're talking about things like training and phishing training, what some of the kind of unique challenges that the NHS have is around actually emails coming from within the NHS itself. So there's kind of 2 divisions, as the panelists certainly know, is where you've got some trusts and organisations that are leveraging the NHS mail service. There's about 1.7 million accounts on that service, and then you have some trusts that are running their own Office 365 tenancy. And one of the challenges that many of the trusts, in fact all of the trusts that I've been working with have, is where compromised accounts within NHS Net and that NHS digital service are launching campaigns into other trusts. And when it comes down to users identifying malicious email or suspicious attachments or links, it becomes a lot trickier when they're coming from valid NHS accounts or people they may have even had a legitimate relationship with. And certainly for the NHS, while I've seen the full spectrum of attacks coming into NHS organisations, and unfortunately, in some cases being successful, that challenge associated with legitimate accounts from NHS.net is something that all the organisations I speak to are struggling with. And I've seen plenty of examples where somebody from NHS Mail has had their account compromised. They've emailed a phishing attack into another NHS trust. That person gets compromised, and then phishing attacks spread within that trust itself. And that's a very much a unique challenge, really, for the NHS. And I'd certainly be interested to understand if the other attendees have observed that kind of challenge.
Definitely. Kelvin, I saw you nodding your head in agreement there.
Absolutely. Because I joined the NHS a few years ago from another sector, and it was really noticeable when I joined, the extent to which compromised credentials were coming through. I didn't see that as much in my previous life. I think that's possibly partly a factor in terms of the scale of the NHS operation, as you say. It's enormous in terms of the number of addresses. So it's definitely, and I think that's something where we all can help each other in that sense. So I can think kind of a recent attack where our guys spotted it pretty much the first thing they did was actually notify NHS Mail that they considered, that they spotted this coming from a compromised account. And that was kind of almost equal weight in terms of the actions that we were taking in terms of protecting ourselves. So I think there's probably more that could be done in terms of all of us as users of the service looking out for these things and making sure that our service provider is aware of those credentials as quickly as possible.
Fantastic. Hannes, I think we lost you there as well. Do you have anything else to build upon on what Kelvin's saying?
Not really. I do have similar experience with Kelvin, to be honest. I was from a different industry previous 2 years ago, and I did quite a surprise as well to see a large number of compromised accounts. Though we frequently and actively always be on the lookout to check for compromised accounts, and whenever that we found out, we immediately try to resolve that. Make sure we tell the users, hey, please not just reset your password for your trust account, and we want you to reset the password that you use your account on all other services that we found throughout the internet. Well, the reason is, of course, because the attraction, I believe, is where on certain website or whatnot, if you register your account with NHS email, you will receive certain perks, certain discount and whatnot. But then at certain point of time, those websites got compromised, their data got leaked out, and people are selling their email address and passwords over the internet. We have seen thousands and thousands of email and passwords that have been discovered because of breaches from a different websites, but people were using our trust account. So that's where also another approach where a long passphrase is really beneficial when it comes on securing your account. Multi-factors authentication plays a role as well, especially when you're logging to email accounts, especially if, for example, Office 365 or even NHS Mail also will have the multi-factor authentication. And another thing that we always frequently on the lookout is we check whether knowing that we are in NHS Trust, we are a UK-based organization. Now, if let's say we start seeing people trying to log in from, I wouldn't want to say the country, but it's like 1,000 miles away from where we are right now, well, that would basically raise a flag for us to quickly check what's actually going on. Was it a compromised account that may be able to lead to phishing mail or targeted phishing mail or whatnot? Another case that we see that because we are at NHS Trust, knowing that for NHS Trust, a lot of people try to get jobs with NHS, and at times, instead of going through a proper channel, we are seeing like a large volume of people sending up files, resume, and whatnot directly to the board member, to the CEO, which can be seen publicly from the Trust public website. And that's where we also need to do the right filtering as well, so that when those emails arrive to those people, they don't basically get compromised to the infected files or whatnot. Yeah.
Thank you for that, Hannes. No, that was a great answer. Thank you everyone for your answers so far as well. And also thank you to our audience who've taken part in our live poll as well. Had a fantastic turnout for the first question. So just to remind you of the question again, how much of a priority is addressing email-based attacks within your organization? 45% of you said it was a top priority. Another 45% of you said it requires improvement, but it's not a top priority at this time. And 9% of you said don't know, which is fantastic information to have. And obviously going forward will help NHS professionals build up that security. I'm going to move to our second poll as well. If you're also asking questions, please pop them into the live chat. I've seen there's a couple come through already, which is brilliant. I'll come back to that in about 10 minutes time or so. So just to start this second poll, is your Office 365 email provided by NHS Digital or provided locally. Yeah, so I'll leave that running for another few minutes whilst I go back to James with another question. So if a user or the email platform is compromised, what impact can there be on patient data or the services to NHS providers, or the services that the NHS provides? Sorry.
Sure. Yeah. I mean, I think we touched on that, some of that, but there's obviously been some examples, if you like, of the impact things like ransomware can have on the NHS, right? And there's of course the huge outbreak in 2017 of WannaCry, but even more kind of recently, this year on the attack of Advance, which affected the NHS 111 service. There's lots of examples out there of the impact that it can cause, but fundamentally that kind of impact can come into two sides. So your one can be around the risk of the event itself, obviously with patient data and NHS staff data, you're potentially being exposed by those kind of incidents. That's kind of one side of things. But if you look at the say the WannaCry outbreak, that cost over 100 million, I think, is their estimate as far as the cost it took to resolve that, and many several months, impacted appointments and things like that. And actually, you're managing the outbreak itself can be even more impactful than the actual risk of data loss. And I was speaking with a large trust last week, and they're still being impacted by the event from Advanced. That was on the beginning of August, if I recall, and they're still managing some of the impact that's had. So, for me, the impact, I guess, around the data that the NHS manage and the risk of that being exposed and the risk of accounts and things like that finding their way onto the dark net is one side of things. But actually, when you're having to manage the outbreak itself, that can often have just as much of an impact. And whether that's systems being down or whether that's having to start up new systems to replace ones that aren't operational, that kind of cleanup operation and that management of the outbreak would be just as impactful. And obviously, if you have, say, your Office 365 accounts compromised, then that can often give access into things like OneDrive and SharePoint and other tools. That is quite a big channel of entry, which is why it's so highly targeted of getting into other areas within the trust. So I don't mean to be doom and gloom or anything like that, but obviously the impact of things like ransomware, phishing, and other kind of attacks can be really disruptive to the services the NHS provide.
Sorry, I'm on mute there. No, definitely. I think that will be a really good one to open up to Hannes and Kelvin as well. I feel like, as you say, we have touched on it, but it'll be great to go dig a little deeper into that if we can.
Well, to be honest, talking about advanced attack, well, we don't really have an actual insight of the full incident. Is it because of ransomware, or is it, how does the ransomware start? Is it through an email, or is it through a removable device, or is it through a malicious connection? But talking about ransomware protection, well, we could not just rely on email security. This is on my own view. Somehow we'll still need to have another solution in place to be able to detect and block ransomware from being initiated. Well, I do believe that Microsoft ATP or MDE did provide a good oversight and overview if, let's say, you have any kind of malicious connection that goes out for ransomware, though it can only do so much. Again, yes, you still need to have another layers that if someone executed a file from an email, while waiting for the MDE to be reported back to us, we still need to have something on the machine to be able to stop it from it to being executed. So I believe endpoint security is another solution that somehow need to be in place and working effectively to be able to prevent this kind of attacks. So that's my view on trying to prevent ransomware.
No, that's fantastic. Kelvin, if you have.
Yeah, I actually have changed my viewpoint in this space, and we're going to continue with a kind of multi-vendor approach. So yeah, so kind of keeping strength in depth in terms of absolutely make full use of all the facilities that the providers offer us, but actually also continue with other capabilities, so that. And we do see this. We do see, certain threats recognised by one vendor, but not by the other. So from that point of view, we absolutely watch all of these big events, and have been building kind of the lessons from those into business cases. Something you haven't touched on in the conversation so far is my board colleagues are incredibly supportive in terms of everything I've asked for in terms of protection. And you often see papers that are saying cyber threats should be one of your key business risks as an organization. There's not been a single time where I've not said this is what's going on in the outside world, this is what we need to do in response. Where kind of board colleagues they've always recognised what I'm saying, and supporting that we need to continue to develop and take our capabilities forwards. I was just going to say, just one other quick point, because this is what really made it real for us was little event in Cornwall, which is the biggest thing in Cornwall, obviously for probably forever. The other year was obviously the G7. There were a few sleepless nights ahead of that one in terms of, are we going to get through that okay? And we did. So I was very pleased about that.
No, that's fantastic. And of course it was. I completely forgot about that. But yeah, that's great. So it kind of brings me on to our last poll of the webinar. So let me just go again. Let me go back to the one previous. So just to remind you of the question again. So is your Office 365 email provided by NHS Digital or provided locally? So 27% of you said it's provided entirely by NHS Digital. 40% of you said it's provided and managed locally. And then also 33% of you said partially NHS Digital, partially managed locally, which is fantastic. But I feel like the conversation we just had really does bring us on really well to our final poll. So how many NHS organisations do you think had a ransomware incident in the last year? If we can get that one started, please. And then that one's live. And if you can use that live poll button at the bottom of your screen, that'll be fantastic. So I'm going to go to the live Q&A really quickly. So I've seen a couple of people have been asking questions. So I'm going to start off with Chris Hind. So staff are told not to store any documents on 365, and now he notices a lot of documents being stored on Microsoft Teams, which I believe is a vulnerability. What are your guys' thoughts on that one? We'll start off with Kelvin, if that's all right.
I absolutely recognise the question. We're probably making more use of Teams, Teams local capabilities to store information, SharePoint, and we're not actively encouraging a lot of use of OneDrive, even though in saying that, I know that actually they're all fundamentally the same platform. And the kind of reasoning behind that is around we want to make sure that we've got more control of kind of our data leakage policies and such, like through things like Intune, before we more widely allow people to use things like OneDrive on a wider basis. And that really kind of ties back to your question around, do people use the NHS Digital provided service or their own tenancies? That's kind of a live debate in terms of the relative difference in control you have between the NHS Digital service and your own.
Fantastic. James, do you have anything to weigh in on that one from Chris?
So obviously I'm not a user, I guess, from that perspective, but I think it's something that's that's obviously been seen, since, I guess really since the kind of pandemic started, is that, all organizations, right, look to, improve and I guess mature their approach to both things like cloud email, but also to things like collaboration services. And I think some of those technologies are what allowed the world to kind of continue on going, right? Is that they were able to deploy those tools very quickly, very easily. Some organizations are already using it, and it allowed people to operate, I guess, in that new kind of world. But with that, it does introduce things like risk, and it does introduce challenges around the control, and obviously kind of having visibility around some of these new channels and these new kind of risk exposures is something that all really kind of have a bit of a challenge with. And we've also seen in general the large adoption of like SaaS applications. So whether that's collaboration tools, or whether that's your calendar tools, or whether that's things like Salesforce and those kind of tools coming in and being delivered in a SaaS focus. A lot of those tools have been introduced into an organization. Some of them might have quite high privileges into things like the Office 365 ecosystem, and that organizations are perhaps struggling at times to kind of get that top level visibility of what applications or what services do they have deployed, what privileges do they have into things like my Office 365 environment, and is there a concern that this application has, for example, got escalated privileges, it's got read-write access into that environment, and just kind of maintaining, I guess, that control and visibility on it. And that's actually an area that Abnormal is advancing into, where it's around giving people that visibility. But I think the average organization's got like 100 SaaS applications, and as that increases, getting visibility into it and visibility into any potential risk that exposes is something that I hear quite frequently.
So I keep forgetting to unmute myself as well. So Hannes, anything on top of that one?
Based on what Kelvin and James have mentioned, yes, I do agree at some certain points where there are certain limits that what we can do and what we can protect, because it all went back on, for example, when our GP or try to communicate back with the users. Yes, depending on how they process the information, they need to also ensure that they did not accidentally share this with another person or elsewhere, or accidentally release it, or send an email back to their own personal email. Of course, this is all also based on user education, but also we always tells the user, if let's say if such incident happens, we want to ensure that report back to us as soon as possible, so that we can prevent from further damages being happen. If let's say if there's any accidental disclosure of patient information, I'm not sure how other trusts are using it. I'm sure that I believe a large number of trusts have these terms called a platform where you can report if there's any kind of breach of personal information or patient information. So staff reports back what happened, and we try to investigate what we should do next. So, but then again, of course, depending on how the organization works, we still somehow needs to when of course that when we need to share documents, we ask information from the patient. We also need to ensure that all the rights privilege are given, and also try to implement for us, like we try to make use of the cloud application security scanner tool to run checks from for security issues in Teams, for example, or SharePoint, and to check if there's whatever files there might be even be infected and whatnot. So yeah, a lot of solutions need to be in place, not just people. Both need to work in tandem, so that sometimes people make mistakes, sometimes tools may not be able to detect. So it needs to work in harmony, I would say, so that to prevent further damages from happening.
No, it's fantastic stuff. Yeah, no, really, really insightful. answers there, guys. Thank you very much. So James, just wanted to ask, so how can abnormal, how are you different from your competitors in this kind of email security space? And yeah.
Sure. So, while there's a number of kind of unique features and capabilities and kind of bells and whistles, for want of a better term, that differentiate us, from our competition, there's, it kind of comes back to a couple of things I mentioned earlier in that, ultimately, when you look at why customers selected Abnormal to help with this problem, there's two outcomes that are really kind of top of the list as far as those reasons. So one is around the effectiveness of the solution. Ultimately from Abnormal side of things, we're utilizing that advanced behavioral AI to prevent all attacks from reaching users, and that precision of detection of eliminating unwanted emails or eliminating malicious emails from reaching users, that precision is always a number one reason for selecting Abnormal. And it's a really, it's one of our key differentiators, is that we're more effective than anybody else at preventing those from reaching users. And the other side of things is it comes back to the kind of skills challenge that we were speaking about earlier on in this panel. I think, if you're implementing any kind of technology within any environment, whether it's the NHS or other, I think if you're placing additional burden on an already stretched cyber security team, it can have a negative impact. So the other side of things that differentiates us from our competition, and is one of the key reasons that Abnormal gets selected, is the from the management overhead side of things. You don't have to kind of spend your day configuring rules and policies on managing thousands of false positives and things like that. The minimal management overhead is one of the key reasons people select us. Really, people go from having a solution that they need to dip into multiple times a day to having a look at it once a week. So for us, as I said, there's lots of things I could talk about, but for us, our key differentiation is the effectiveness of the product at stopping those kind of attacks, and the other side of things, which is that it's super easy to use, and people can spend their days focusing on many other challenges that we've discussed on this session.
Exactly, and then it's all leading to the highest possible quality of patient care at the end of the day as well, and making sure that everyone's safe in the cyber world as well. So just going back to our last poll there as well. So again, how many NHS organisations do you think had a ransomware incident in the last year? 30% of you said 1% to 29, 25% of you said 30 to 59, and 35% of you said 60 to 79, and 10% said more than 80. I'm sure we could get back to you on the actual figure for that. James, I don't know if you do have a figure for it.
It was a loaded question.
Was it?
But it was, and it's in our NHS white paper, which if you Googled abnormal security NHS, you can access it there. But it was 81%. I guess that supports some of the things that we've been talking about as far as the threat landscape is concerned.
Wow. Sorry, 81% from which year to what year?
That was last year till December 2021. Yeah.
Wow, I didn't realise it would be that.
Wow. And I would class anything getting through as an incident. If we mobilise our team to respond to it, that's an incident. Whether or not it has an adverse impact on anybody, I think that's the key point. So I'm not surprised it's so high in terms of stuff getting through, and you having to do something about it.
Mm-hmm. Yeah, and I think it's as you say, there's probably different degrees of the impact, I guess, that event had. But it's certainly one of the big challenges that I find all organisations and every kind of trust has, and if you're talking about email specifically, is that if it's made it through your Office 365, it might have made it through another tool in that space and landed within users' inboxes. You're kind of relying on user-reported incidents or actual incidents taking place, right, to get the visibility of that incident, and that's something that a lot of organisations struggle with is actually understanding what is making its way through, because unless a user reports it or there's an incident as a result of it, you don't get to see it. yeah, that's something that we help with our trials and things like that. Is actually giving them sight of what they can't see. Thanks, Jack.
Brilliant. Yeah, sorry again, I keep forgetting to unmute my microphone there. So I've actually got a couple of questions from our audience just to finish off with. So Linda Sidney is saying, can you please provide a link for NCSC security compliance checks, which I'm sure we can do at the end of this. And Rosemary Edmonds has said she works at a GP practice and patients are requesting their own personal medical records via Hotmail, Gmail, etc. So when we refuse, the patients get very angry with us. What should we be doing in these cases when patients can have access to their personal records? Hannes, would you like to start us off on that one?
Well, to be fair, that's a very challenging question for me to answer. I might need to refer to our information governance team, to be honest, to see what kind of information that they were releasing. So depending on what kind of it, so if let's say reviewing it after it's approved, then yeah, certainly we can get that release. Of course, it depends on how does an organization process such information. So I would suggest that try to reach back to the respective parties trust to see how can they release such information, or if let's say before you do that, are you breaching any kind of PII or personal information or whatnot. So yeah, that's my view. How about you, Kevin?
Oh, yeah.
Yeah, as you say, very, very difficult to kind of talk about a specific example there, but it is that tension between the rights of patients to access their information and obviously the obligations on us to do that in a secure way. So I completely agree with the response in terms of information governance professionals advising. What it means for us in terms of broad solutions is we've tended to use secure file transfer systems in the past to rather than email, and we also have kind of documentation solutions where patients can receive information electronically through those. Our longer term approach really aligns with the national approach of patient portals and the NHS app as ways of giving people control over their information. So that's kind of our more kind of strategic approach in terms of longer term sharing of information and actually giving people the ability to change their information, because that's a key point of the reason we're making that access available is for people to correct things that are not right.
Fantastic. Thank you very much for everyone's answers as well. Like Kelvin, that was a fantastic answer to finish us off on. I think we've just run out of time. There's been so many questions. There's loads more that I could probably ask, but unfortunately we don't have enough time for it. So I'd just like to thank everyone for joining us today, and also to our amazing panelists for their insights. I've really found it fascinating, and I've definitely learned something, especially not being an expert on the subject myself. So yeah, thank you guys for providing that information. So again, there seems to be loads of questions coming through today, and any of which haven't been answered, I'm sure we can look on to pass on to you guys, if that's okay. I'm sure many in our audience will have diligently taken notes throughout today's discussions, but in case there's anything that you need to reference to reference back to, don't worry, because this will be on demand within 48 hours of the event. So thank you again so much, everyone, and have a great rest of your day.